So welcome to week 3. I don't know where the last 2 weeks have gone. So you guys should be settled in this class and your other classes for now, right? Everybody's been to class, knows the syllabuses, know when things are due, have done a master schedule for this term, right? When everything's due, right? Um, does anybody have any questions about last week? Okay. This week, today we're gonna do the quiz 2 first. And then we'll go through that quiz, and then we'll do an overview of the content of the four concepts we're covering today: the migrants population, the rural population, then homelessness and poverty. Then I thought what I'd do, if we have some time left at the end of the class, um, we can have a look at the HESI prep and see what we can fill out on that. And I'd like to review the concept guide that you got for exam 1 a few days ago. Okay, I'd like to just go through how to tackle studying for exam 1. Reviews are this week. You have a master schedule. I believe I'm doing a review this afternoon. I think the other ones are Thursday and Sunday with Professor Ford and Professor Kershaw. So you should have that schedule. So if you can get to a live review, that would be fantastic.
Professor, Majesty says she got kicked out of the class.
Okay. I have her here in a box. I just don't have her camera on. Majesty, can you hear us? Maybe tell her to come back in. Jakesia, can you tell her to come back in?
Yes, let me text her.
Thanks.
She said she's
So,
in the waiting room.
nope, I don't have anybody in the waiting room. I'm sure she'll pop up here, but I don't have anybody right now in the waiting room. Um, so we'll try and go through that review. I also have sent you out your groups. This was a pretty easy class to group students with same campus students. I had maybe one outlier, but everybody else, your group should be within your campus. Um, so you have your groups. So if you want to start having a look at who wants to do what for your exam, hang on. Got some people that are trying to come back in. Kristen, I see you.
Yeah, I'm sorry.
No worries, no worries. Nope, just glad you're here. So questions. Do we have any questions?
I had, but you just said something about it. We were the group that had one person outside of our school in our group. So I
Okay.
guess we'll try to communicate afterwards.
Yeah. I mean, like I said, there was is I couldn't make it perfect, but I did the best I could. Okay. Majesty, there you are. Okay, good. So everybody, let's go ahead and take quiz 3. Remember, it's a key graded assessment, so it has to be proctored. So stay on camera while you're taking the quiz. We'll do 15 minutes. It's 105, so 120. Okay. Um, and just keep your cameras on. Okay, and when you're done, you go get a drink, go to the restroom, whatever. But we need to be back at 120. And I'm going to mute myself as well. So if everybody else could mute themselves, that would be fantastic. I think everybody is muted. All right, so go ahead and do quiz 2. Okay. Kristen, how are you coming? I have everybody else has submitted, so thank you. We'll just wait, see where Kristen's at. All done, Kristen? All right, let's go through the quiz. Lots and lots of tens. You guys did well.
I'm sorry. Yes, I'm sorry.
That's okay. Congratulations,
I didn't know you were
guys.
waiting on me.
That's okay. Congratulations. That's awesome. Good job preparing for class. Let's go through it. Okay. Everybody see my screen? Okay. So, what should the home health nurse anticipate about clients in very rural communities? What did you learn about rural communities?
That they would be more likely to have chronic illness due
Right.
to
And
lack of resources and everything.
yeah, other than resources, why else are they rural populations going to be at higher risk to have more complex chronic illnesses? What did you learn about rural populations?
Not enough access to healthcare.
Access.
So,
Access is what else?
They live like far away from the healthcare.
Mm-hmm. Mm-hmm. And so we know that A is the correct answer. Most of them will actually not have employer provided insurances, right? Most jobs in the rural community don't come with health insurance. They're typically hourly paid jobs, right? They don't come with health insurance and retirement benefits and vacation time. So they will, most of them will not have employer provide insurance. C, they'll actually be more likely to have environmental, excuse me, chemical exposures. Why is that?
Because that's pretty much where they have like all the implants and stuff.
Well, what's happened in the rural community?
In the
A lot of-
rural community, they have more farm workers, and I mean a lot of farm workers and a lot of like smoke and stuff into the community.
Yeah.
From the
So lots of high risk occupations, right? Which is going to make them more at risk to have exposure to chemicals. And we'll talk about this when we cover the content, but one of the biggest risks to the rural community is pesticide exposure,
pesticides. Yeah.
right? Pesticides. And then, as one of our students said, most of them will have adequate access to physicians. That's actually the opposite. They won't have adequate access to physicians. In the rural communities, very limited healthcare workers. Okay, you may have one physician for the whole community, may have one nurse for the whole community. And if you need specialty care, that's not available in the rural communities. You have to travel for that. So A is the correct answer. Number 2, the nurse is developing a primary prevention program for members of the rural community. Which one of these interventions is primary?
Sun exposure, the excessive sun.
Right. So providing information on minimizing excessive sun exposure, that's a primary prevention. We're trying to prevent any sun-related illnesses or injuries before they occur, right? What is A? Primary, secondary, or tertiary?
Secondary.
And why is it
Tertiary.
secondary?
Because for like a screening,
It's
Screening.
primary.
a screening for
Oh, is it
pap smear.
Screening. What about C? Which is C? Primary, secondary, or tertiary?
Tertiary.
C,
Why is it tertiary?
because it's already had diabetes and you just want to treat it now.
Correct. Does everybody understand that? Okay. What about D? Which is D? Primary, secondary, or tertiary?
Secondary.
Secondary, because you're screening for blood pressure.
Screening. Right. Exactly. Good job. Good job. Migrant farm worker presents to the migrant outreach clinic complaining of bilateral eye irritation, throat irritation, and cough. Which nursing intervention would be appropriate? What do we know about migrant farm workers? And
That they're
What-
working outside around chemicals. So I put B.
B.
yeah, ask the farm worker if they apply chemical pesticides at work, right? Some of the hints in that question were the population is the migrant farm worker. And then they gave 3 symptoms: bilateral eye irritation, throat irritation, and cough. Okay. In your notes for this week, we'll go through it again, but we went through what are the acute symptoms of pesticide exposure and what are the chronic symptoms of pesticide exposure. And those 3 symptoms were symptoms of acute exposure, correct? Okay. Next one. During a home visit, the nurse notes that the migrant farm worker's family is living in a small house with several other families. Which nursing assessment is a priority? So this is again, like last week, this is a good example of a question that may look to have more than one right answer. So if that's the case and it's not a select all that apply, what do? We go back and read the question to see if we missed a key word or a cue or a phrase. What's the key word in this question?
Priority.
Assessment priority.
Priority. All right. So as we're talking about migrant farm workers, we read about what risks they have if they're living in close quarters. What's the risk? What's the primary risk?
TB.
TB. So this is where you would do a symptom screening questionnaire, right? Everybody understand that about migrant farm workers? Okay, question 5. Which statement reflects the impact of income on health outcomes? This is a poverty question.
C.
Mhm.
What did you guys say?
Low income increases the risk of chronic illness.
Okay, everybody get that right?
Yeah.
Okay, we'll talk about that when we talk about our content. Yes, we talked about the introduction to poverty, right? Low income definitely increases the risk of chronic illness. Maybe due to access, due to finances. Okay. And as far as the other answers, low income guarantees access to Medicaid. That's not necessarily true. Okay. Medicaid, it's just, it depends what your income is, whether you qualify for Medicaid. High income reduces attendance to wellness visit. It actually increases attendance. All right. If you have high income, you're more likely to have insurance, and therefore you are more likely to schedule and attend your wellness visits. And then D, high income does not improve health comes. It actually does with the insurance factor. Okay, if you have high income, you're likely to have insurance, and therefore you're seeing physicians, you're getting to your wellness visits, and you're hopefully improving your health outcomes. Does that make sense? Okay, what should the nurse anticipate for a family living just above the federally defined poverty line? This is in your notes.
A,
A, right? Just because even though you're living just above the poverty line, you still have increased vulnerability due to a lack of community resources, right?
Yeah, because they say that you're making enough, but in reality, you're not.
Exactly. Exactly. I had a student a couple of terms ago that talked about this. Her and her family were right above the poverty line, and she qualified for nothing. Nothing. Okay. Question 7. Which client is at the highest risk for adverse health comes related to poverty? We talked about this last week in our introduction to vulnerability. Who is the highest at risk?
A.
The children. It's not to say that the elderly man, the 68-year-old man, is not at risk, but the question is asking who is the highest. So it's a priority question. Okay, so if you got down to A and C, the child is at higher risk than the elderly. Remember we talked about that last week? Okay, so A is the correct answer.
So children, even though they have no health problems, they will always be the highest risk for okay,
Related to poverty.
for poverty. Yeah, okay.
Yep, yep. What should the school nurse expect from an impoverished adolescent? What's the key word in there? Impoverished. Okay, so let's think about this. What might we see? Let's say you're working in the schools. What might you observe with an impoverished adolescent?
Increased risk of dropping out of school.
That is key,
And yeah, like they can't focus.
right? Well, they may have lots of other things going on, lots of
A
other
lot.
risk factors going on, right? With regards to A, it actually increases the risk of unintended pregnancy, correct?
Mm-hmm.
If you're an impoverished adolescent, you probably don't have a good use of adaptive coping mechanisms. So C is just the opposite. And then same with D, improved attendance to extracurricular activities. It's the opposite. Decreased attendance. Okay, but the key is increased risk of dropping out of school. Okay, which client is at the highest risk for homelessness? Again, another priority question. All these children, which all these clients may have a risk of eventually becoming homeless, but who has the highest risk?
The veteran.
Veteran.
Veteran with push.
And why? Why is the veteran here the highest risk?
Because he's
Because-
living alone and he has post-traumatic stress disorder.
And living alone. Okay, all these others have a risk of homelessness. Okay, but C, the adult with schizophrenia live in a group setting, they're in a setting with other people. Okay, adolescent with substance abuse has a supportive family. They're with others. They have others to help look after them. Older child with a history of suicidal ideations. Okay, but the veteran is alone. And then lastly, the nurse is working in an outreach clinic in a homeless shelter, which clients should be prioritized. What are some important words in this question? What's the setting?
Uh,
Shelter.
Homeless shelter.
Homeless shelter.
B.
And they're asking who needs to be prioritized?
Would it be A?
Would be A.
The answer's A. Why is the answer A? What are these signs of? Potential signs of?
Tuberculosis.
Tuberculosis.
CP, right?
And
got
is tuberculosis a high risk in homeless shelters?
Yes.
Yes. It's not that B, C, and D don't have to be seen. Okay, but the question is asking, who is the priority client? Well, we need to sort out whether there's a potential outbreak of TB in that homeless shelter. B is may look like an infection. Okay, that has to be seen. That has to get looked at. But first, we have to determine if we potentially have an outbreak of TB. So that's where the priority comes in. So again, another example of if you're wavering between A and B, go back and look at the question. Who needs to be prioritized? Okay, make sense? Let's have a look at our notes. Are your other notes helpful every weekend?
Yes, they are. Thank you.
Giving you an overview. So let's go back to, and remember, here's the 4 concepts: migrants, rural populations, homeless, and poverty. Remember, in your modules this week, there's no book reading this week. Did you all figure that out? Where your reading is this week? Okay, there is no book reading. It all comes from your Canvas reading. So when it says Canvas reading, it's built right into Canvas. And there is a teaching sheet in Canvas on each of these. Okay, I want to go to these first because I want to point out a couple of things before we go to review our notes. So when you think of a migrant farm worker, what do you think of? What do you think? Seasonal?
Yeah. Mm.
Go ahead. What do you
Someone
think
working out in the field.
of? Maybe seasonal, moving around a lot, maybe going from one job to another. What about if they have a family in tow and the kids are working on the farms?
Could it be a low income for a lot of them?
Poverty is extremely high in the migrant farm worker population. Some other issues are language barriers. Okay, farm workers coming in from all over the different parts of the world. So you're going to have you may have a language barrier. You may have literacy issues. How do they understand if they don't feel well or if they have some kind of an exposure to chemicals? How do they understand where to go get help? How does healthcare work in their region or wherever they are? Where do most of our migrants come from?
Different countries.
Right? Primarily, though, they come from Mexico. Okay. According to the National Center for Farm Worker Health Facts about agricultural workers, which they are, approximately 16% are migrant workers. Okay, and 84 are seasonal. So these people are coming and going. Let's say they get seen in a clinic where they're working. What's the likelihood of their medical records getting transferred to their next point? Now, let's say they've been diagnosed with a chronic disease, diabetes, hypertension, and they're getting treatment in one place. What's the likelihood that everything's it's just the continuity of care is just gonna work perfectly? It's not. Okay, the majority of these populations are predominantly Hispanic, born in Mexico. Okay, interestingly, 68% of the agricultural farm workers are males, right? The average 38 years old. And then just under half, 49% of all farm workers in the US are unauthorized workers. So that brings up the immigration issue, right? Migrant farm workers may be reluctant to go seek care because of their immigration status. Okay. Common health concerns specific to the migrant workers. Okay. These jobs are very physically demanding and intensive, and the intensive nature of their work brings up several risk factors, several health concerns that may put the farm worker and or their families at work if they're traveling with a family. Heat-related illnesses, exposure to a variety of pesticides, toxic chemicals, UTIs and other infections, lack of toilet facilities, lack of sanitary conditions. All right. Another potential health risk is bites from animals, insects, rodents, snakes. And then this particular population, the migrant farm worker, has a higher susceptibility for infectious diseases, communicable diseases, such as TB, which may be a result of substandard living conditions and lack of access. Then let's not forget about mental health. Mental health issues are very prevalent in our migrant farm workers. Depression, anxiety, relocation, poverty, stress. Okay. Some barriers. Okay. What are some barriers that prevent rural migrant farm workers from receiving health care or receiving healthcare coverage? All right. So go ahead. Farm workers face numerous challenges when seeking to find health care or affordable health care. They don't typically qualify for health insurance. There are migrant clinics. I think there are migrant clinics, but I think they're only it's in here, maybe 26 states. So if you're working on a farm that's not close to any kind of a migrant healthcare clinic, it presents even more challenges. So the cost of healthcare, shortage of healthcare services, that's an issue in rural communities where migrant farm workers work. Okay, there's not a lot of healthcare workers in the rural community. Okay, lack of culturally and linguistically appropriate services. That would mean interpreter services. What if you're dealing with families that don't speak English? They don't understand what their symptoms mean. They don't understand where to go. They don't understand their follow-up instructions. And then very confusing eligibility requirements for migrants. Okay, these are hourly paying jobs. All right, so they don't have insurance. They don't have the ability to get sick leave. So if they're sick, let's say they need to see a specialty physician, they have to travel, they have to take the day off. They're much less likely to do that if they know they're going to lose a day of pay. Migrant farm workers also face social isolation and exclusion. And then we talked about the undocumented worker, fear of how their immigration status will affect their eligibility. We talked about them moving around a lot. There's some good videos on here, pardon me, to watch with regards to services that are being worked on to help the migrant population. Let's make sure we've covered everything. Language barriers, and transportation is the other issue. There's typically a transportation issue. They don't have private vehicles, or a lot of them don't. The other risk for female migrant workers, high risk of sexual harassment or abuse. Kids working on the farms, lots of risks, right? Sun exposure, maybe bodily injury with equipment or tools, pesticide exposure. We know that our food supply would collapse without the work done by these migrant farm workers, right? Yet they're typically looked at as a very unseen part of our society, right? An estimated 2 to 3 million of these farm workers are working seasonally to get food to the market. We talked about the housing. It's either not available or it's substandard, maybe sanitation issues, structural issues, mold, lead, broken appliances, lack of climate control, right? Some of our migrants live in cars and tents. And then when housing is available, and this is one of your quiz questions, when housing is available, it tends to be very overcrowded. That can contribute to risks of TB, GI issues, hepatitis. All right, we know that migrants are very high risk for chronic diseases, such as diabetes, poor health, obesity, depression. And kids affect, the children's affect, malnutrition, infectious diseases, dental issues, maybe inadequate immunizations, pesticide exposures, injuries, disruption of their school and social lives due to constant mobility. So the good news is there's something called the Migrant Health Act. Okay, it provides primary and supplemental health services for migrant workers, including these outreach clinics. Now, these are federally funded clinics. There's 154 of them, and they're in 42 states. They serve almost 3 million people, but they're only serving a small percentage, right? I have this highlighted in yellow. I'd like for you to know this because you're going to get asked about this on the exam 1. Please know the difference. This is why this was a quiz question. Please know the difference between acute and chronic pesticide exposure. There's a difference. Okay, acute, memory loss, difficulty concentrating, mood changes, abdominal pain, nausea, vomiting, diarrhea, skin rashes, eye irritation, throat irritation. Okay? Chronic. Let's say you work on a farm for 10 years and you have been chronically for 10 years had chemical exposures, pesticide exposures. some of the risks, birth defects, cancers, blood disorders, neural problems, reproductive issues. Okay, maybe some infertility, liver damage, Parkinson-like symptoms. Okay, so be able to identify the difference between acute and chronic if you're given a scenario like your quiz question of somebody presenting with certain symptoms. Okay. There's a lot of similarities between migrant farm workers and the rural populations. There are some differences, but there's a lot of similarities because the migrant farm workers are typically working in the rural areas. Right? We know that access to healthcare for everybody is key. All right, everybody. But rural residents face a variety of hurdles. The number one is access. Okay? And I'll show you there's some maps down here below, but access is huge, right? Everybody deserves to have quality healthcare, primary care, dental care, behavioral health services, emergency care, public health services, right? We know that this is key for the general population. These kinds of access to these kinds of health services improve our overall physical, social, and mental health status. Okay, this is for all of us. Okay, disease prevention, disease detection or condition detection, diagnosis, treatment, improving our quality of life, avoiding preventable deaths and life expectancy. So that's what we should all have access to. But rural residents do not. Okay, they often encounter many, many barriers to healthcare that limit their ability to obtain the care they need. Okay, it's very hard to recruit rural healthcare workers. And I'll show you this in a map here below of all the shortages. With regards to rural population, they may not have the financial means to pay for the services, right? Especially like dental insurance, eye insurance. Okay, they may not have transportation. Transportation is a huge issue in the rural. There's no public transportation, right? If they have to go see a specialist, it may be located hours or miles and miles away. Talked about, same with the migrant, lack of motivation to take the day off. Okay, confidence in their ability to communicate. This is that language barrier, right? If they're not fluent in English, they have less confidence in their ability to communicate what's going on, understand their treatment plan, and be able to dialogue with a doctor. And lack of trust is a big issue too, right? Compromising their privacy. It goes back to that, maybe that immigrant status. Can I trust this doctor won't turn me into the immigration office? Okay. So we start to talk about some of the barriers. You guys can read this in more detail. Distance and transportation. Here's your workforce shortages. Okay. In purple, this is health professional shortage areas for primary care. Purple is the rural areas that have shortages in health professionals. That's a lot of purple. A lot of counties, a lot of states with big shortages in professionals, healthcare professionals working in primary care. And remember, primary care, what's primary care? Routine follow-up, trying to prevent things before they happen. Some of the other barriers, health insurance we talked about, internet. Internet is not always a given in the rural areas, right? So to try and have telehealth visits may be challenging because lack of internet. We talked about poor health literacy, and then the social stigma, privacy issues. A big issue in the rural areas is anonymity, wanting to remain anonymous. One of the issues in the rural community is residents may be reluctant to report certain things: child abuse, child neglect, domestic violence, violence of any kind, substance abuse. Why? Because if there's only one clinic in town with one doctor and one nurse,
They all know each other.
everybody knows
Yeah.
each other. Everybody knows everybody's business. And so a lot of times you have a lack of reporting, which is sad. But when you finally do get to see maybe victims of abuse or mental illnesses, they're typically at a more advanced stage and it's more of a crisis level, right? Why is primary care important to rural residents? Well, because we know that rural residents don't prioritize primary care, right? Primary care is the most basic, and along with emergency and public health services, one of the most vital services needed in the rural communities. In the rural communities, we're dealing more at the tertiary level, right? They already have something, right? They didn't do their primary prevention because maybe they didn't have access to services. Maybe there's no screening services available. What types of healthcare services are frequently difficult to access? All your specialties. Let's say you need an oncologist or a neurologist or a cardiologist or a pediatrician or an obstetrician. You're not going to have that in the rural areas. You're going to have to travel for that. What does traveling mean? Loss of job or loss of pay for that day. Do you have transportation services? And then hospice and palliative care are difficult in the rural setting as well. Lots of barriers, similar to other healthcare services in rural areas. Workforce shortages, recruitment and retention programs, reimbursement issues, transportation of a hospice nurse up to and from a rural area. And then lastly, mental health services. Okay, mental health services are lacking significantly in the rural areas. And the saddest thing is that in the rural areas, that's where we have the highest incidences of mental health illnesses, substance abuse, alcoholism. So you may have one physician in your community and they're handling everything, right? They may not be an expert in mental health diagnoses or assessments. Look at the shortages of mental health professionals in America in the rural areas. That's in purple. Again, that's a lot of areas that have shortages in a service that is direly needed in the rural areas. Substance abuse disorders, oral health, we talked about that. The good news is there's lots of strategies being, I want you to read through this. There's lots of strategies being worked on by lots of different companies, foundations, groups, federal agencies to improve the access to care in the rural communities. Right, multiple strategies are in place from delivery models, meaning maybe small clinics can partner up with bigger healthcare systems. Okay. affiliate with larger systems and networks. There's efforts to improve the workforce, efforts to improve recruitment and retention to work in the rural community, working on telehealth, making sure rural communities have access to the internet so that telehealth can be used more effectively. Working on programs to help the veterans. There's a lot of veterans that live in the rural community. Okay. And then there's a lot of American Indians, Alaska Natives, and Native Hawaiians who live in the rural communities. So programs are being worked on to help them with access. And then here's a list of organizations working to improve rural healthcare access. So you can read through this on your own, but it's kind of sad to talk about the lack of resources the rural community has, but this is rather encouraging, knowing there are so many organizations working to improve rural healthcare access. Okay. Let me make sure I didn't miss anything. What do we consider rural? Farm, maybe a small town, a village, compared to a city population. And there is a population shift, believe it or not, from the urban to the rural areas. It's more affordable. Yeah, you may not have all the resources that you need, but there is a shift of moving into the rural communities, right? The typical rural population is usually under 18 or above 65. Typically residents, just some demographics, residents have fewer years of formal education, fewer college degrees. This is pretty incredible. More than 25% of rural Americans live in or near the poverty line. 25%. And 40% of rural children live in poverty. Much fewer residents have insurance or adequate insurance. We have already talked about rural adults less likely to engage in promoting health and wellness, right? They're more likely to smoke, have higher rates of alcohol abuse, obesity, less likely to take advantage of screenings and wellness visits. One of the biggest health issues in the rural community is complex chronic diseases. COPD, hypertension, diabetes, cancer. Okay. Rural populations definitely have a higher infant and maternal morbidity and mortality rates, right? Especially in areas with poor physician coverage. There's just no OB or no pediatric care. You have to travel for that. If you have a high risk OB, if you have a high risk pregnant mom, she's traveling for all those high risk, or maybe needs to relocate down to where her high risk OB is until she delivers. Some of the high risk industries in the rural areas: forestry, mining, marine related fields, and agriculture. Lots of increased risk for accidents due to large people operating large pieces of machinery, car accidents. They're not focused on primary care. They may not use seat belts. Maybe more exposed to trauma, cancer, allergies. Okay. So that's an overview of rural community and migrant population. What are you thinking? I mean, what if you think of yourself as a rural nurse? We talk about community nursing and different roles in community nursing. One role is a rural migrant nurse. Think of all the challenges that would present, right? What kind of challenges would that present? I mean, you may be go ahead.
I'm sorry, I didn't mean to talk over you.
No.
For me, what I experienced a lot, like you was talking about earlier, was communication barrier, language barriers, for the actual person and even a nurse, because you don't have a lot of workers that, speak in their language.
Right. I mean, if you are hired as the community nurse to work in, let's say, a reservation, okay, you may be the school nurse, you may be the immunization nurse, you may be the health clinic nurse, you may be the health educator, you may be the labor and delivery nurse. Think of all the hats you need to wear. Very, very challenging. And think of the backup. Where's your closest backup as a nurse? It may be on the phone with a hospital that's far away. So to work in the community, to work in the rural community as a nurse is extremely challenging. I mean, you have to bring all your tools in your toolbox to that job, right? Okay, let's shift to the homeless population. We did an overview last week in the introduction to vulnerability, but think about the neighborhood you live in now. I don't think any of our neighborhoods are free of homeless clients. So what do you think when you're driving down the street or taking a walk, or what do you think when you come upon homeless encampments or homeless people or homeless families with kids on the street? What do you guys think about?
What do they do at night? I lived in Colorado and it's freezing in the wintertime, and I would just think how cold it was.
Mhm. What else do you guys think? What comes to mind? Has anybody ever worked with the homeless population?
How did they get to this predicament? Like, how did they get here?
Yep. That's Sharice, that's the first thing I think about is what's their story? How did they get there? How did they get here? Especially with families. I was very much exposed to homeless families when I was working in the schools for 20 years, especially after the pandemic hit. People losing their jobs, people living in poverty, living in their cars, living in tents. How'd they get there? And, most people don't want to be homeless, right? And they're very reluctant to accept our help. Okay. We talked last week about therapeutic communication and establishing trust with this community, but it's a very sad situation, and we know that here in the US, homelessness is increasing exponentially in every community. But if you're working in the community as a community nurse, you're likely to be engaging with clients who are homeless. They may come to your clinic. They may come to your medical facility. They may come to your urgent care, your emergency room. Right? You may encounter them in the community. So what do we know about the homeless? It affects everybody, right? Let me just look around your community. Many of you did your discussion one question, pick a vulnerable population in your community and talk about them. Many of you did the homeless. I would encourage you, if that is a population in your community that you're interested in knowing more about, I would encourage you to take your discussion one question and use that as a springboard to do your end of the term vulnerable populations assignment on. Okay, lots of students do their vulnerable populations assignment on the homeless in their community. Okay, and it's an extended version of your discussion one question. We know homeless affects everybody, men, women, all ages, children, races, ethnicities, occupations. On any given night, it's estimated that upwards of 600,000 people in the United States that are homeless. And sadly, 1/3, it's estimated 1/3, so a couple 100,000 are families. All right. We know that homeless people are much more at risk to become ill, have greater hospitalizations, are more likely to die at a younger age than the general population. Sadly, the average lifespan for a homeless person is between 42 and 52 years. That's young. Okay. We saw this in the schools all the time. Homeless kids are much sicker, have more academic and behavioral issues. Obviously, they're living in poverty, right? They don't have the funds for housing, for food, for clothes. The homeless population tends to have increased mental illnesses, psychiatric illnesses that are exacerbated by drug and alcohol issues. Okay. And how do we define homeless? Most people think that homeless people are people living on the streets only. That's not true. So it's, let's say you're living in a shelter. You don't have a permanent place to go. Let's say you've moved in with a friend or relative, don't have a place to go, a permanent place to go. That's considered homeless. So during the pandemic, when lots of our families are moving in with other family members or moving in with friends or neighbors or whatever, those families were considered homeless. Okay. So you can be living in a friend or neighbor's house, a shelter, a mission, a facility, an abandoned building, in your car. But that's not considered, that's still considered unstable, an unstable situation. Okay. We talked about affecting men, women, children of all ethnicities. Risk factors. Lots of risk factors. Chronic illnesses, substance abuse, mental illness. Unemployed, living in poverty. Homelessness has an incredibly significant impact on kids. All right, infants born into homelessness have low birth weights, 9 times more likely to die in the first 12 months. Homeless kids are much sicker, 4 times more sicker than children who are not homeless. Right? We saw this in the schools. Asthma, iron deficiency, lead poisoning, respiratory infections, ear infections, GI infections, emotional and behavioral problems at school, anxiety, depression, acting out behavior, withdrawal, aggression, hostility. Right? And they're also at much higher risk to exhibit developmental delays in the school setting. They experience hunger. These are the kids. They experience hunger, maybe abuse, neglect, separation from family. So what's our initial approach in working with the homeless, right? It's typically an outreach visit. I mean, if you drive routinely, I drive routinely through a homeless encampment, I'm always seeing support people out on the street trying to help. These are your outreach visits. Okay. Outreach visits, approaching them on the streets, approaching them in the shelters, approaching them in the schools, right? What's their story? That's what you want to know. You want to ask them, what is their story? You can't assume what their story is. You can't draw conclusions. You need to have empathy and respect. Non-judgmental, asking open-ended questions. right? So for example, a family with kids, maybe these kids aren't immunized. How do you start the discussion to establish some trust so that the mom may open up to you and accept some of your resources that you're trying to provide her? Getting the kids into a pediatrician, getting a checkup from the pediatrician. Okay, so establishing mutual trust. Okay, once you've established trust and there's been some kind of a relationship or rapport developed, right, then maybe you can work with the next step of identifying what the needs are, what their goals are. Okay, we know that homeless people tend to have the same medical conditions as the general population, right? However, maybe homeless people experience more long-term exposure to the disease agents. Maybe overcrowding, unsanitary conditions, poor nutrition, sleep deprivation. I mean, everybody in both the homeless setting and non-homeless setting, we all experience the same things, but it's much more exacerbated in the settings where the homeless live. Okay, cardiovascular disease, dual diagnosis, your mental illness with your substance abuse, cognitive disorders, maybe TBIs, injuries, violence, all increased with the homeless population. Okay, there's issues with infectious diseases, communicable diseases, STDs, skin and foot problems, maybe due to exposures, lice, scabies, bacterial infections, poor living conditions. Exposure related conditions we talked about. Lots of resources here. So if you end up doing your paper on homeless, come back to this. Come back to this Canvas reading page. Okay, it has a list of numerous references that you can get information on. Okay, so it's your notes are clumped together with homelessness and poverty. So let's jump to poverty real quick and just see what we need to cover in that, and then we'll go back and review the last part of your notes. Poverty. The most of this at the beginning is history. History and Census Bureau information. You can go through and read that on your own. We know that poverty tends to be clustered in certain regions and certain counties. It's not evenly spread across the nation. Okay, we know that research has shown that poor living in areas where poverty is prevalent, the risks are huge. Okay, beyond any of the individual circumstances. It's the region, the area you live in. Okay, we know that poverty contributes to poor housing, poor health conditions, higher crime rate, school dropout rates, employment issues, right? So when economic conditions are poor, it can create limited opportunities, all right, for the poor residents, right, to try and get out of this perpetual cycle. Okay, there's several graphs on this page that are interesting if you want to look at them. Poverty rates by census. Okay, non-metro versus metro area. Significantly higher poverty rates in non-metro areas in several of these sections. Okay, look at it. Here's your poverty rates based on race and ethnicity from a metro area to a non-metro area. And then by family type, by age. Okay, poverty, how is it defined? Okay, the federal government determines our poverty line. Okay, it's adjusted annually. Okay. Poverty, let's see. Poverty is defined as being able with a family or individual with a total income less than the amount deemed to be sufficient for a few things: food, shelter, clothing are the three most important. Food, shelter, and clothing. All right, so lastly in your notes, so before COVID, the number of Americans living in poverty was the lowest since 1959 at about 10.5%. After COVID, it climbed to 17%. And the child poverty rate is at 21, about 5 million children living in poverty. Okay, we talked about the federal poverty line. Insufficient, what does it mean? What does the word poverty mean? Insufficient resources to meet your needs. Oh, I'm sorry, transportation is the other one. Food, shelter, healthcare, and transportation.
Did it rise after COVID because of all of the job losses that occurred? Why
Yeah.
did it rise? Yeah.
Yeah.
Okay.
Yeah. People having to stay home to take care of their kids. Right. Contributing factors: unemployment, loss of retirement benefits, inadequate education, job training, maybe weak enforcement of the child support statutes, outsourcing of jobs, increasing the number of children born to single women, right? What does it contribute to? What does all this contribute to? Chronic stress, mental health issues, higher rates of chronic illness, higher infant morbidity and mortality, shorter life expectancy, more complex health problems, disabilities. And people living in poverty that don't have health insurance or the homelessness, where do we typically see them for their health care when they don't have insurance? Where do they get their health care?
Don't they go like to the health department?
Super expensive. They go to the ERs.
Yeah, true.
Right? They go to the ERs. They show up in the ERs because they don't have any access to wellness care, preventative care. They show up in the ERs, which is hugely more expensive. Right? Young children. This is one of your quiz questions. Young children are at the highest risk for effects of poverty, right? Lack of adequate, nobody's advocating for them. Lack of nutrition, poor brain development, maybe exposure to environmental toxins, trauma, abuse, right? More chronic diseases, more developmental delays. Okay. So here's your drop out of school question. 14s are more likely to have below average academic skills, 3 times more likely to drop out of school, higher rates of pregnancy. And with pregnancy, with a teen pregnancy comes potential additional risks with complications during the pregnancy, lack of prenatal care. Okay. I think we covered everything in here about homelessness. Okay, so here are a few things from this week's content. Primary prevention. Well, we covered the migrant farm workers. Teach ways to avoid pesticide exposures. Advocate for immunizations. That's primary. Advocate for better living conditions. It's primary. Right? Everybody understand why those are primary. If we're advocating for better living conditions of rural migrant farm workers, then we're trying to prevent overcrowded living conditions. Secondary, maybe we're screening for evidence of financial instability that relates to poverty. yearly blood pressure, A1Cs, education on the important for cancer screening, pap smears, colonoscopies, mammographies, TB skin testing, that's all screening, early identification, early intervention, right? And then tertiary, they've got something, maybe providing guidance on either pharmacological or non-pharmacological management of lower back pain. Maybe helping the homeless client find some resources. They're homeless. That's what they have going on. Helping them find resources. Referring people that have STDs to the health department for testing. Teaching a client how to take their medications. That's tertiary. They're taking the medications for something. Okay. So that's a lot of content. This is the first real week when we're covering specific populations that you can go into your HESI prep. It's towards the end under vulnerable populations. I think there's a couple of boxes that you can complete. It's not a whole lot right now, but there are a couple of boxes. I want to pull up the study guide. Whoops. Need to share. Okay, here's your study guide that you got a few days ago. Here's my suggestion. Pretty much all of what's on here you've already seen. Okay, I put this together as a combination of a few things. All right, they're from your weekly notes, they're from your readings, and from lecture. All right, so most of this you should have already seen. I've tried to organize it for you to list the concepts in each week. And then I've copy and pasted all the readings for each week from the syllabus right into here. So it's an easy reference. Okay, so everything's right at your fingertips. Probably overdoing it, but just try to help you guys out a little bit. Okay, so and then when you get into the study guide, it goes through, it's all right in line with how we did your notes. You got your week 1 concepts. Okay, everything's going to look similar. Week 2 concepts. Everything's going to look similar. But what I've done is I have in our weekly notes, that's the broad overview of the concept. Lots of information, lots of detail that I like to cover so that you have a good understanding of the concept. What I've done with this concept guide, study guide, is to narrow that information down with each of the concepts as to present you with the most important bullet points or knowledge points that you need to know for the exam. Does that help? All right, so this is an abbreviated version of all 3 weeks of your notes, right? I would encourage you to start here. If you get to Introduction to Community Nursing and you're thinking, I'm still struggling with that. Go back to your readings in week 1. Chapter 1. Okay, or C-Canvas course, Introduction to Community Nursing. Okay, if you're struggling with any of these concepts, and I've highlighted all the concepts, there are 4 concepts in week 1, 4 concepts, 2, 3, 4. So you got 12. You have 4 concepts in each week. They're all highlighted and broken out into weeks. I would start here. If you can articulate this study guide, now I don't mean memorize it, I mean articulate it. If you could read through Introduction to Community Nursing and think about, what question might I get? Maybe I'll get a scenario of, here's what the nurse is doing. Is she practicing community-oriented nursing? Is she practicing community-based nursing? Okay, because remember, the next gen format is not to test your knowledge, but it's to apply your knowledge to clinical judgment. Right? So you're not asking, what is community nursing? What is community-based nursing? It's the nurse is working in the community and here's what she's doing. What is this? Does that make sense? And I can tell you with all of the childhood ailments, I told you at the beginning, this is a heavily focused med-surg class. There's a question on every one of the childhood ailments. All right, but if you look at your notes from week 2, your asthma section is much bigger. I've condensed it here to the most important points to know to understand the concept. Make sense? That's how I would attack it. I would start with this study guide. If you don't understand a certain section, go back and do your readings about that. Go back and reread the notes for that section. Go back and reread the book or the Canvas reading, whatever it's associated with. Every one of the 12 concepts has reading associated with it, whether it's a chapter in the book or pages in the book or Canvas reading. Okay? And then at that point, if you're still not understanding it, please make an appointment with me prior to your exam to go over what you're not understanding. I'm happy to review anything with you, but I need you to do your due diligence first. Okay, and put your effort in with studying and taking notes and going back and rereading. And really the most important thing is being able to take all this knowledge and apply it to clinical judgment. Look at your quiz questions for the last 2 weeks. They've been clinical questions, right? A person presents at the migraine clinic with bilateral eye irritation, throat irritation. It's a clinical question. Okay? Very little, there's no more definitions. There's no more memorization. It's taking your knowledge and being able to take care of a client. Make sense? You guys will be fine. If you have a good understanding of the concepts, the 12 concepts we've covered over the last 3 weeks, you'll be fine. Just think clinically focused. How would you treat somebody with asthma? How would you treat somebody with eczema? How would you treat somebody with diabetes? Okay. Now, this particular exam is heavily med-surg focused. I think close to half the questions are, I think, childhood ailments. So, I mean, there's questions on every concept, some more than others. All right. So that's how I've organized it for you. Again, I've probably gone a little bit overboard, but I realize this is very busy term for you. I'm not trying to do it for you. I'm just trying to keep you organized. Okay. Questions? Helpful? What are you guys thinking? You've now had all the information presented to you, weeks 1, 2, and 3. Now, if you can attend a review, great. If you can't, you'll be getting the recordings of all of them. And after you do your due diligence studying, reach out to me over the weekend or Monday, whatever, and set up a tutoring session and we'll get together and talk about what you're having trouble understanding.
I have a quick question. When you say it's clinically, the questions are clinical, is it like for example, we're trying to do preventative care before it becomes tertiary care?
Uh-huh. Yeah,
Okay,
there's several primary, secondary, and tertiary questions on the exam. So know your primary, secondary, tertiary. Well, I mean, it's pretty simple. You had a couple of questions on the quiz. Prevention, screening, treatment. There's a big difference between prevention and treatment. And a lot of times the way the questions are worded, pretty easy. Remember, here's another rule of thumb if I didn't talk to you about it last week. If the information that you need to answer, let me rephrase that. The information you need to correctly answer the question is in the question. If it's not in the question, it doesn't exist. That means you're adding in information from overthinking. You're not expected to, you're expected to use only the information in the question. That's all you need. Guess that's bottom line. If you're adding in all this stuff like, well, what if this happened like 6 months ago? Or what if they really mean this? It's not the question. And a lot of times I review with students and I'll say, why'd you pick this answer? And they'll give me an answer. I'll say, where'd you get that information? Well, I just thought that, this, no. If the information is not in the question, then it doesn't exist. That's a tip for all you overthinkers. And for goodness sakes, don't change your answers. Unless you can convince yourself 100% that your answer is wrong, like you accidentally selected the wrong one, or you know for sure you selected the wrong one. Don't change your answer on, well, I think I remember her saying this, but I'm not sure. I think I remember reading this. Not sure. Don't change your answer on the I think I remember, I think I heard. Don't. Changing your answers will hurt. Okay? That's my mantra. Guys will be fine. Fine. Okay? They're not it's not trick questions or it's not gotcha questions. These are just straightforward questions like your quizzes. Okay? And math. 5 math questions. Simple math questions. All right. If you struggle with math, go back into week 1 and find the announcement of Professor Bogart, pediatric instructor. Find her email, find my announcement about her tutoring session. She does a real easy start from the beginning math 101. Easy tutoring session. Go listen to it. If you struggle with math. Easy peasy. She gives you the tools to answer all the math questions. And the math questions on these exams are simple. You got to be able to know how to convert or set up an equation, convert milligrams to kilograms, that kind of stuff. It's simple stuff. Okay? All right. Reach out if you need anything. Have a good rest of the week.
I need to speak to you after class.
Okay? Stay on. And good to see everybody.
I have a question. I know